All right. So it'll probably ask you if you're okay with the recording. I just started that. And so let's go ahead and get started today. So here's what we're going to be talking about. Like I said, my name's Lainey Flynn. I'm the Assistant Director for Health Professions Advising. And I'm going to take you through these different topics today. And in addition, answering any questions you have in your sophomore year. So I want to start with introductions. So I'm down here at the bottom. This is Cindy Seltzer. So she's our director for Health Professions Advising. We are both full-time advisors at the college that are here to support you throughout your pre-health career. So please feel free to meet with either of us. We are both available for one-on-one appointments in person and on Zoom. So hopefully you've done this already, but if you haven't at this time, you definitely want to kind of check in with us. We are hopeful that most students meet with us at least once a year to do like a check-in one-on-one. And then of course, when you get to your application year, the year you're applying to medical school, we'll see you and be emailing you a bit more, right? So more contact during that time for sure. If you've never been to Green Hall to career education, we're on the 4th floor. That picture over here on the right is kind of what it looks like when you come up now. So if you do want to do an in-person appointment, it can be a little confusing to get here the first time, but that's what you're looking for. And we do love to see folks in person as well. So that's us. The other part of our team is our peer career mentors. So has anyone heard of these folks yet or met with them? Yes? Awesome. So peer career mentors are really helpful. So they are student advisors that work part-time for us that are in either sophomore, junior, or senior year. So they've had a little bit of experience within the pre-med, pre-health curriculum, a little experience within their major, and also extracurricular experience as well. And they are here to meet with you all one-on-one to give you any advice you want from a student perspective. So our first PCM here is Grace. She's wonderful. She's a senior. I believe her major is biology, and she does a lot of research. So she's a great person to talk to about how she got involved with research and how that kind of became a passion for her. She works in the Darling lab on campus, and she's also done quite a bit of research over the summers. So these QR codes down here at the bottom link you to their bio page with a calendar. So they all do bookings via Google Calendar. So not Handshake, a little bit different, but actually pretty easy. You just pop onto their Google Calendar and pick a time that you want to meet with them. So Rhiannon here in the middle, she is actually pre-PA, so physician's assistant. She is excited to go on to physician's assistant school after Wellesley. She's a great person to talk to about clinical work. So she got her medical assistant, or sometimes we call it an MA for short, certification, and she now works as a medical assistant in the Boston area part-time. I believe she works for the Atrius Health system in Boston, which is they've got clinics all over. But she would be a good person to talk about, like, how's that going while you're a student, and how did you get your certification, and what's the best way to get clinical work? So, or of course, anything. You can ask them anything. She's also a senior. Ilham, here on the right, is a sophomore. Ilham was part of our pre-med scholars program last year, and she also was able to do some research over the summer at WashU in genetics. So she has some really good experiences, and is also a really helpful mentor as well. You can also go to them and ask questions about, like, classes, how did you like this professor? Did you take Orgo 1 before 205? And how did that go for you? So questions that I might be like, I'm not sure, I didn't do 205, that they may have a better perspective on. They're great to talk to about that. So definitely scan those QR codes, jump on their calendars and use them as a resource. And then one other resource I want to share with you is that if you're not already signed up for our newsletter, we have a health professions newsletter that goes out once a month with all the great information about programs we have going on, jobs, internships, all the stuff that you're wanting to know. And we send that out to you all. So you sign that up for that on Handshake. And this slide shows you how to do that, because it's not one click, unfortunately, so I can't just send you a link. You do have to go to handshake underneath your name and select career interests. You can also sign up for other newsletters. So like if you're thinking pre-med, pre-health, but then you're like, yeah, maybe STEM, maybe research, there's actually a STEM one as well. And of course, all other areas. Any questions about that? So just some kind of stuff to start you off, get you introduced and get you connected. And then we'll start with our how life is supposed to go slide. So you're in your sophomore year, and obviously you probably have lots of peers doing lots of wonderful things. And, sometimes I hear in my advising appointments with students, um, this peer is doing this person got research here, this person got to Europe, this person's working with faculty, I'm not doing enough. And there's a lot of comparison, right? But what I want you to know is that once you get to the point of applying to medical school, when we're talking with those folks, everyone's path looks really different. It's very unique. It may be a longer path. It may be a shorter path. They may have done lots of research or just a little bit of research and more clinical work. And really, everybody is kind of all over the place to where they've gotten to this point. So as much as you can, try not to compare yourself to other people, right? Because it's likely you're not behind, especially as a sophomore, you still have plenty of time. And really all these journeys look different. And the other like general advice I can give you is, the best medical school candidates follow their interests and passions. So instead of thinking like, oh my gosh, all my friends have worked in an MIT lab, I need to work in an MIT lab. No, how about figuring out what research you're actually very interested in and then finding that position, following those passions so that when it comes to for you to apply to medical school, your excitement for the things you've done really shines through in your writing and your interviewing. That makes a big difference. So definitely following the things that you're really loving and enjoying rather than comparing yourself to others. Okay, and then I have this gap year slide. So I do have some data that I'm going to share with you from the 2024 applicants. I think it's just helpful for you to see kind of what your peers have done. And so you can see this first pie chart is Wellesley applicants, the second is accepts and their gap year time. It's good to think about gap years now because, as you probably know, if some of you are thinking about going directly to medical, dental, or other schools, you do have to apply in your junior year, so it's sooner than later. And you can see from this pie chart that folks that go direct, this smaller portion here, they do just that, right? So that's direct means going right from undergrad right into medical or dental school. Most people, on the other hand, take gap time, right? So take time between undergrad and medical school, and we'll talk about what they might do. But our most common amount of gap time is 2 years, and then other folks take 3 or 1 gap year as well. So even, there's people that take 4 or 5 gap years that are admitted into medical school just fine. So gap time is really common among Wellesley students. It's very common nationwide. So most people going into medical school these days are taking time between undergrad and their medical or dental program. Okay, so what might you do in your gap time? Because sometimes I tell people about gap time and they kind of freak out, like, I don't want to just sit there around and do nothing. I have to be like moving forward in this process. Well, gap time is a time that you can do a number of different things, but all of those things have to do with enhancing your application or allowing yourself more time to get a better MCAT score or improve your GPA. So you're very active in the process, even in your gap time. So we have a lot of students that go into research in their gap time because they really love it. They find a 2-year research position and they dedicate their time there. But we also have students that want to do clinical work. So they'll do something like get an EMT certification and work in emergency medicine. Or like I was saying, Rhiannon got our medical assistant certification and now works doing that. Some folks will do that in their gap time. Those are great entry-level medical positions that allow you to get a lot of patient interactions and care for patients in a way that you probably wouldn't be able to do in another capacity, which is hard to do as a student, right? So spending time in your gap time doing that as well. And you can see some other ideas here. Folks may do a fellowship, they may do a service project. Some folks choose to go to graduate school, or just to make a little bit of money, right? Because, medical school is expensive, and that may be something that's important to you as well. So the reason, again, I mentioned gap time early is because gap time kind of changes the way you map out your classes. And I think probably most of you know that at this point. So here is the academic coursework you need for medical school. We can talk about specifics if you have questions, but this is generally speaking what you need. And if you are going direct, you have to have all of this done by the time you apply, which is your junior year. If you're not going direct, you can spread it out a little bit more, and have it kind of fall into your senior year as well. So how is everyone here doing on their coursework? Feeling pretty confident that you have a good plan to get all of these courses in? Yeah. Any questions about coursework? It's good to note that there are some schools that ask for an additional upper level biology class if you don't plan on taking one. Typically, there's schools in Texas. So if you're from Texas, it would be good to take an upper level bio like genetics or something like that. Um, Also, someone sent me a school in the southern states, again, maybe Arizona, where they also wanted an upper level bio. So although we still see that as being rare, you can look up your top couple medical schools, and it'll list out on their website specific coursework you need, and you can just do a double check that they're not one of those schools that really wants you to have an upper level bio course.
I have a question.
Mhm.
So for biochem, does that need to be with lab or can it be without lab too?
Great question. So you can take one without lab. So it's not required to take the biochem with lab. The only reason you would have to is if you are a biochem major, because then they do require you to take the lab. But if you're not, then you're fine with the non-lab class. Um, and also, I have a question in the chat about writing. So you're typically medical schools want to see 2 semesters of writing. 1 semester is covered by your first year writing requirement that you all already did in your first year. You do want to have one more course that's writing intensive, but oftentimes at Wellesley, if you take a humanities course, maybe it's history, religion, something related, maybe a women gender studies course, and you find that most of the coursework is writing based. So a lot of the assignments, a lot of the things you're doing are writing based. That can count as your second writing intensive class. And if you have specific questions about that, we can look at the syllabus and see if we think that one would count. You can also take another English class if you really love English. That's fine as well. But usually you can get that covered within your distribution requirements or humanities classes. Okay, and then another question about can you take these classes over the summer? So that's also a really good question and a common question we get. So that one is a little bit more of a gray area. When you think about medical schools looking at your transcripts, you really want to show to them that you're capable of academic rigor each semester, right? So it's ideal if you can take all your courses within the academic semesters because you're taking 4 at a time, you're challenging yourself, those types of things that you're going to have to do in medical school. There won't be the option to do kind of a summer class in medical school. You really have to be doing the challenging all the courses at once in a semester or however they structure it. But that said, if you decided to take one class in the summer, like I know physics was offered last summer, some folks took that, or if you had a one-off in that way, that is probably fine because the rest of your transcript is showing that you're capable of doing 4 classes a semester, and you're showing academic rigor. It would be more of a problem if it was you were pulling out STEM classes specifically and taking one at a time in the summer, summer 1, I'm going to take Orgo 1, summertime, I'm going to take Orgo 2 because I don't want to take them with other classes. That is a little bit more questionable because they may look at your transcript and say, all right, are you pulling out these STEM classes one at a time to make it easier on yourself? And does that mean you could be successful in medical school? So you just have to be kind of careful about when and how often you do the summer classes. Does that help? Summer class question? Okay. And certainly if you have like a specific question, we can definitely do a one-on-one meeting. So I have this big major sticker here because you get to declare your major this year, right? Woohoo! Everyone's ready to do that. So I think you probably heard this before, but you don't have to choose a STEM major. You can major in anything and go pre-med. You just have to make sure you have the coursework. The other nice thing about declaring a major is you'll get a faculty advisor in your major, which I think is really helpful for students that are looking to connect more within like the specific field and also maybe engage in some research with faculty. So getting a faculty advisor will be really nice for you. So plan on, meeting with them and engaging with them as much as possible because I think they can be a really good resource as well. So the other thing we have to consider when we consider academics is that your medical schools are going to be seeing your transcripts, which reflects your GPA, right? So it is important to keep up a strong GPA if you're planning to apply to medical or dental school. And that really goes for PA, physician assistant school as well. All of those are very competitive programs, and they're really looking for students that are achieving good grades in all of their classes and specifically their science classes. So this is just a little bit of data again from the 2024 cohort of applicants. So the first slide maybe not, or sorry, the first chart might not make as much sense to you because it's MCAT info. So if you're like, what are those numbers? Don't worry about that yet if you haven't taken the MCAT. But the second chart here is looking at GPA. So the lighter color orange is the national average for accepted MD students, and the darker orange as well as LEAF students. So you can see that cumulative GPA hovers around a 3.7, science GPA closer to a 3.8, and non-science GPA back down to about a 3.75 for Wellesley students. So those are averages, remember. So if your GPA is lower than that, that's okay, right? You can still, move forward on the pre-med track. First of all, you have time still to bring it up. And also we say, as long as you have a 3.5 or above, you tend to be competitive in the application process. Obviously, a really high GPA is helpful as well. But we know that not everyone can have all A's, and that's okay too. So if you shoot for that 3.5 or a higher, and you're staying on the pre-med or pre-dental track, you can still do okay in the process. So it is good to check in on your GPA kind of semester by semester to see where you're at. We can also have like conversations about this when we meet. Okay, so that's academics. So again, when you're applying to medical school, they're going to look at your academics, they're going to look at your MCAT score, and then they're going to look at your experiential extracurricular activities, right? So those are other things that we want to just make sure we're engaging in and getting experience with sometime throughout your time at Wellesley. If you haven't done anything outside of the classroom yet, that's totally fine. There are things you can start to engage in this year and moving forward. And also remember, if you're someone that's okay with taking gap time, you're going to be doing some of this stuff in your gap time as well. But we put experiential learning into 3 categories. So research is the first one, volunteer work, and then clinical work and shadowing. Sometimes volunteer work and clinical work shadowing kind of like overlap with each other. And we can talk about like where your experiences lie in a one-on-one, but those are our general kind of like 3 categories. So this is just a slide about how you may pursue research at Wellesley. At this point in your career, you probably know there's lots of different ways to do that, but it's not always easy. You can look at opportunities through the Science Center or MIT Europs. We have students that do that every year. We also have students that start with research on campus with a faculty member that they've reached out to or engaged with. And then we have kind of our outside of Wellesley experiences. and our more like structured summer internships that you can apply to as well. As a sophomore, you really have more summer internships available to you than you did last year. Some of them are not available as a first year, but you probably figure it out. Or if they say they are and you apply, sometimes they'll say, we're not going to take them this year. Let's wait till next year. So sophomore year and on, you kind of have a little bit of a better opportunity to get some of these structured internships. And we have a database that I can share with you on some of the pre-med, pre-health internships around the country. And then there's the new experiential learning browser, which has all of the opportunities through Wellesley. Has anyone gone to the browser yet? Okay, cool. This is what it looks like. This is just a screenshot. If you haven't been, this QR code should take you there. And so this has, like I said, the internships that we called signature internships that are the Wellesley spots at different places where they're funded over the summer, all of that, Wellesley Seats. That has all of those as well as others. So there's actually some other internships in there as well. And so this is a really helpful new resource that you can use in order to find some of those extracurricular things that you might want to get involved in. So definitely bookmark this page and start to kind of peruse through it to kind of figure that out. Questions about any of the internships opportunities or things you've been thinking about doing so far? Awesome. So some of the internships coming up this summer, which feels far away, it kind of feels like summer today still, have early deadlines. So that's the one thing you want to pay attention to is some of them will have a November 1st deadline. So that's only a month away, right? So make sure that if you are interested in doing a summer internship, that now, probably in the next week or so, you start to put together the internships you're going to apply to and then the deadline so you know when to apply to each one. I will real quick kind of switch over. Can you still see my screen if I switch over to this? Okay. You see that database? All right. I will pop this one in the chat if you haven't seen it. This is the one that one of our students started to put together that's organized by state. And so these are kind of all around the country. The nice thing about these, most of them are structured, paid, they provide housing, those types of things. So that's all really important when you're looking for summer opportunities. So I will put this in here. So if you're thinking about applying to a summer internship, or you really want a summer internship, I would definitely try to apply to more than one because they are competitive and you never know what's going to be the best fit. So creating a list for yourself, maybe 5, 6, however many you have the capacity to apply for, and kind of casting a wide net so you can see where you land. So this is a great resource. The AAMC also has their own list, which is this one. I'll drop this in the chat too. There will be some overlap, but similar idea. Some are undergraduate research programs that you can look into and apply to. And like I said, most of them, now that you're a sophomore, you can definitely apply to. So looking at geographic location is important, and then looking at fit if you're interested in the research, that type of thing. And then let me just pull up the browser for those of you that haven't had a chance to see it yet. This is the one that I just showed you on the last slide. And we'll put that in the chat as well. So if you want to bookmark some pages, you can you can do that today. So this is what the browser looks like, and it has a filter on the side, which I think is really nice because you can filter by year and so forth. So just as an example of something that you would apply for sooner than later, if I click one of these, it should give me more information like that. And then I can actually click the program application page itself. And so this is one of those career education internship placements. So we used to call them signature internships. It's the same thing. And so these are the ones where we have seats just for Wellesley students. So you're competing against Wellesley students, but at least not everyone in the country, right? So you can read more about the opportunities. You get funding for these, like I said, and kind of how those programs run and how to apply. These are the ones that have early deadlines, November 1st, right? So that's coming up pretty quick. So those are good to know about sooner than later. So kind of perusing. If they don't say career education internship placements, then it's still good to apply. They're still internships. They're just different than the ones offered through career education. Does that kind of make sense? Okay. So those are all really good places to get started. And then the last one I'll show you is if you are an international student, there's this nice page here that the University of Michigan actually created for experiential learning and internships just for international students. So I'll drop that in the chat as well. Hold on, let me make sure I don't have to let anybody in. All right. Cool. Questions about that? I know I'm giving you a lot. Feeling good? Feeling good. Okay. Am I back on my presentation? All right. The reason I ask you is because I've talked before and then like you can't see what I'm talking about and then someone tells me like 10 minutes later. Okay, so let's talk a little bit about volunteer work. Anybody here started some volunteer work on campus or off campus yet? Good, good. Yeah, so that's definitely something that's nice to get involved in, especially early. Because usually you don't have to dedicate a whole lot of hours to it, but you're able to get some good quality experiences. And there's also student groups and orgs that take part in these as well, which can make it a little bit easier for you to get started. So Alzheimer's Buddies, I know, is a popular one on campus, as well as Boston Healthcare for the Homeless. I know those are both active this year, but certainly if those types of experiences don't interest you, you can do other things as well. The Family Van is a great organization where they provide access to care for folks in communities that don't necessarily have nearby clinics or care access. The crisis text line, I've had a couple students work for them and find that really rewarding. And you can do that obviously from home. You're responding to folks in usually mental health crisis, right? And they train you and everything on that as well. And then folks also volunteer at the hospitals, right? So going into Newton Wellesley, Brigham and Women's, something like that as well. So I put a couple QR codes on here. This one in the middle is for civic engagement. So civic engagement is basically volunteer work you can get involved in on campus. So signing up for their news mailing list could be helpful to know what's going on campus and how to get transportation to those places. And then Boston Cares is a volunteer calendar in the Boston area where you can look every single day and see what kind of help the Boston area needs and how you can get involved in that way. Super cool. That might be a one-time experience, but it also might be a one-time experience that opens up doors for other experiences as well. Anyone want to share like something that they've done for volunteer work that they feel like has been rewarding or that you really enjoyed that others might be interested in? I feel like Julia, you want to share? Are you do you have anything you want to share?
Um, I volunteered this summer at the women's lunch place, which is in like it's kind of near the like Newberry Street
Mhm.
stoppage. It actually is on Newberry Street, but it's basically a homeless shelter with all women. And it's just a really nice place to help out. They have a lot of different um like volunteer opportunities, like helping out in the kitchen or like just talking to people or like helping them check in. So
That's
that's
very
a cool
cool.
place.
Yeah.
Yeah.
And were you interested like in the population specifically, or you just wanted to kind of like give back to the community in any way you could?
Yeah, so I was actually introduced to this organization through a different organization I work with since we held an event there raising awareness for lung cancer screening.
Mhm.
And we went to go talk to the people staying there, and I had some really meaningful conversations with the people there. Like one of them, I was actually able to practice my Mandarin by talking to her, and like talking about her experience recently immigrating here. And we actually talked a bit about the family history of cancer. So that was really interesting. And I did not expect that at the beginning, but like the people there, so like, you can connect over all these little things. And then I also met a Haitian immigrant, and I've been learning Haitian Creole over the summer, so it
Nice.
was super cool. I
Yep.
practiced a bit of that. So yeah, everybody there is really nice, and it's a really great community.
That is awesome. Thank you so much for sharing. There's so many things I like about that. Yeah, one thing you kind of showed us is that like one experience can lead to another, which I feel like is very true about so many of your extracurriculars leading up to medical school. Is just like making connections with folks and allowing get yourself to be open to different experiences that might come out of those connections. And so Julia kind of did just that, right? So involved in one organization and then introduced to another through that and introduced to very cool people through that, right? So that's a great way to do it, right? It's just to put yourself out there, try something. And if you're not sure, check out this Boston Cares calendar and you can just go one time, right? And just meet people and see what it's like and see if it's something you might want to do more of. And another thing I really like about what Julia kind of has been doing is it doesn't have to be like you're going to Newton Wellesley Hospital and volunteering there. And sometimes actually the feedback I get from students that volunteer in a hospital is like, I don't get to do that much. Like I have to just wave at people as they walk in, or I show people to their room and that's all I do, right? And so what you really want to look for is experiences that are meaningful to you. They don't have to be healthcare specific. They really just need to be giving back to your community, showing service, and allowing you to kind of grow. And that's what you're really going to want to talk about on a med school application. So following your passions with volunteer work is super important. So really thank you for sharing that experience. Awesome. So questions about volunteer work and ways you can kind of get involved? The other thing that's really good to know is if you're like, okay, I have a really STEM heavy semester of classes, I feel very overwhelmed, and Lainey's telling me to do a lot of extra stuff. Keep in mind you have your summers, right? So summers are a great time to do some of the more extracurricular things we're talking about. In summer, you don't just have to do one thing either. So let's say you decided to work in a research lab during the week, but you had weekends open and you thought about, wow, maybe I can go volunteer at a homeless shelter on the weekends. Like summer allows some more time to do these things where you're not really having to focus on the hard academic work that you're doing as well. Oh, and this is just something I wanted to share with you because it was shared with me. Is that so on campus we have the bees and the she's, right? So we have some peer health educators, and then the she's are the sexual health educators, I believe. And they're always looking for students to join and be health educators. This is a really good, again, resume booster thing to have on your med school application that you've done health education on campus. And you can sign up to do the training. This one happens to be this Sunday. But Nancy, who you see here, you could email her to see if there's any other opportunities for training. But if you did want to kind of join and be one of these balanced health educators, that's something that you could get involved in right away if you're able to go to that training. So just an upcoming opportunity for you all to kind of think about. QR code will take you there. And please let me know if any of the QR codes aren't taking you where you need to be. Here's another way to get involved this year. So this year we're offering an upskill track for medical professions. So this is new. So this is a program that allows you to go to Harvard Medical School and take part in their med science program. So I was able to observe this last year. It's a very cool hands-on program that gives you the chance to do clinical work. So you can see here they're working obviously with like a fake patient or a mannequin patient, but it's really interactive where this patient could talk, blink their eyes, move a little bit, tell you what was wrong with them. And you actually, there's folks that work there. Like there was a person that was the attending that would come in and check and see if you were treating the patient right. And then you learn other clinical skills as well. So it's just a really cool program, and we're opening it up to some students to do it this year. It is over winter session, so that's good to know in case you already had plans to go far, far away, which is obviously fine too. You could always apply to do this next year. But it is the week before you come back. So I think that's like around the 14th of January. And we do provide housing, so you'd come back, move back in early. But just something to know, like when you're applying, that it is over the end. It's towards the end of winter session. So another chance to get some work and some connections in the field. Questions about that program or anything in that regard? Awesome. Okay, so shadowing and clinical work is our other area of extracurricular work that we hope that you can get in before you apply to medical school. So obviously clinical experience is very beneficial for a number of reasons. It gives you experience in a medical setting so that you know that for sure this is what you want to do. And also kind of gives you some patient experiences, which I think can be really meaningful before you decide to go to medical school or dental school as well. Um, it's also helpful if you have the opportunity to shadow with a doctor, which I know can be really hard to lock down because doctors are busy and hard to get a hold of. But shadowing a doctor would mean just following them around for a day or two and just getting the experience of what it's like to be an MD or a dentist or a PA in action. So that's another thing that can be really helpful to do as part of your clinical work. Some examples of what students do for clinical work, medical scribing. So that is where you're taking the notes for the physician or the PA or nurse when you're in the actual appointments with patients. So medical scribing is popular, although I heard that that might transition over to fully AI in the next couple of years. That job won't exist anymore, which would be interesting, but also kind of makes sense, I guess. Um, Becoming an EMT has been a popular thing among some Wellesley students, which I think is like a lot, but some people are all about it. Becoming an EMT is a little bit harder to do when you're a student because you have to it's like taking additional classes and getting a certification. So it can be a lot. But certainly if you're interested in emergency medicine, that might be something to look into in the summer. Becoming an MA is also another option. And there are different training programs to become an MA. And so then you work directly with patients doing kind of some basic clinical work as well. But you don't have to get a certification. You don't have to have a significant amount of hours in order to apply to medical school. You do have to have that if you're applying to PA school, becoming a physician's assistant. That process is a little different. So if that's in your wheelhouse right now, you might want to think about getting a clinical certification. But for medical school, you just want to be able to have some kind of experience within a clinic and have some patient interactions. So some of the stuff like with Alzheimer's buddies, how they go and they speak with patients and they play games with them and things like that, that kind of falls within this patient area, even though you're not doing direct medical care. So there are some other things you can do in order to kind of prepare yourself to get where you want to be. Anybody here have done any shadowing of a physician? That would want to, okay, that would want to share like how you were able to get shadowing, how you went about it. Yeah, go ahead.
So, I haven't done any shadowing since being at Wellesley, but when I was in high school, I just had family friends that were doctors, and so I was able to reach out to them and do shadowing that way. Um, uh, and yeah, and then from there, like they just helped me know other physicians, which is really nice because I was like, I'm really interested, but I don't know how to get into these specialties. So, yeah.
That's awesome. Yeah, thank you for sharing. So usually, like, if you come to me and Cindy and say, "How do I find someone to shadow?" The first thing we'll say is, "All right, do you have anyone in your life that you know that's a physician, including your own physician, right?" Like, I have a primary care physician who I go see, for my well checks, and I have a women's health doctor, right? And I have an eye doctor, right? So I think about my doctors first, and what relationships I have. And then, like, if you have any friends or relatives that are physicians, certainly I know that not everyone has that, of course. In that case, we can talk more about it, but you can reach out to offices, and just ask if they're taking anyone for shadowing. We do have a pediatric office in Arlington that we send students to sometimes to reach out to because it is a Wellesley grad. That is called Purple Crayon Pediatrics. And they love to have our students come and shadow and do different things within their office. But if you're not interested in pediatrics at all, that might not be the right fit for you. The other way to network and kind of find folks who may be working in medicine and willing to take you on as a mentee or someone to shadow would be to find alum to connect with. So if you have Facebook, which I know that's hit or miss these days, there's a Facebook group called Wellesley in Medicine. And you can only join if you're a Wellesley student, and pre-med is another requirement. So like when you go to join Wellesley in Medicine on Facebook, they'll ask you to like fill out one of those like little forms that says, "Who are you and what do you do?" And so you will just tell them you're a pre-med at Wellesley. And then once you're part of that page, they have a network of doctors all over the country, actually, that are alums that you can try to connect with. They have a database, as well as I've heard of students just posting on the Facebook page and saying, "I'm looking for shadowing. Is anyone available?" So that also works. And then throughout the year, especially during Health Professions Week, in the spring, we try to have alum panels, and those alum usually offer their emails and things like that. So thinking about different ways you can make connections with folks in order to see if you can either just chat with them about what they do or get in and do some shadowing as well. If you have more questions about that, feel free to schedule like a one-on-one we can talk to. I put the name of the Facebook group in the chat as well. Okay. Okay, so this slide is in there because you're sophomores. So if you're planning to go direct, you're getting close to your application time. So this is just a quick slide to say that if you want to go directly to medical or dental school, you do have to start the application cycle next year. So the biggest thing there is just to check in with us this time next fall, let us know your plans and talk about your readiness for the application cycle. You also have to think about entrance exams. So that's the MCAT for medical school, the DAT for dental school. You have to take those before you apply. So you kind of have to think about the timing around when you're going to study and when you're going to be able to take the test itself. So definitely some more considerations if you're thinking about going direct sooner than later. So it would be good to kind of check in with us if that is part of your plan. All right, so let's talk a little bit about letters of recommendation. So for medical and dental school, you will get letters of recommendation, and you will also get a committee letter written by someone at Wellesley, which we'll talk about, which is kind of like your overall letter of who you are and why you should be admitted into medical or dental school. One of the things I like to bring this up now, as far as letters of recommendation, is you will have to eventually ask your faculty and or supervisors for letters. So just thinking about when you're having interactions with faculty, how you can kind of build relationships with them or visit office hours, or just create time to let them know kind of your goals and interests, so that when it comes time to ask for a letter, you feel comfortable about who you want to ask. You will have to have letters from 2 STEM faculty, 1 non-STEM faculty, and then letters from 2 or 3 folks that are non-faculty. So that may be a research PI, that could be a athletic coach, that could be a supervisor in an internship, a supervisor in clinical work, so someone outside of academia. So it's good to know that now to think about who those folks might be. And that makes it easier when asking time comes around. You don't actually have to ask people until you're in your application cycle, so don't worry about that part. It's more about like thinking through who that might be. And if you're like, I don't really know, right? Then maybe you're in a class now where you really like your faculty member and you could start going to their office hours and building a relationship there. So you still have time to make this decision, but at least it will be on your radar. And then we have our committee letter, and I just kind of want to share what that means. So a committee letter is a letter written by and approved by someone on our MPAC committee. So the MPAC committee is a committee of faculty here at Wellesley and Cindy and I as advisors, and you are assigned an MPAC committee member once you join the application cycle. So if you're going direct, this would be next year. If not, it would be the year you start the cycle. And then you get to know them through some written work that you'll do and a mock interview. And then they end up looking at all your application materials and writing you this committee letter that goes to all the medical schools. Committee letters are very positive. They talk about your background, your experiences, your clinical work, your academic, everything. They even take quotes from your letters of recommendation to put in there. They really help you in this process. So once you're in the application cycle, you're filling out your application materials and we are putting together your letter packet. So we put together this letter and then we grab all your letters of recommendation that we talked about. We put them together in a pretty packet and we send them off to the medical school. So that part we do. Your responsibility is really just making sure that you show up and you are helping folks get to know like how you want to be conveyed in these letters, right? So again, not a process that you have to worry about yet, but just to have it on your radar and kind of understand how that works. Questions about that? Okay. And then I'm going to share with you just a little bit of data. So that, again, this is from 2024. And it's just to kind of share with you how our students do in the process. So it gives you some totals and then breaks it down by medical, dental, MD, PhD, and first-time applicants. So Wellesley has a really good acceptance rate. It's much higher than the national average. I think it's closer to 40% that apply. So we do really well in the process. Here's that 3.5 GPA I mentioned. So you can see all applicants were at about 78%, but when you take consideration the applicants that above a 3.5, it really boosts it up from there. Also, our students go to medical and dental schools all around the country that are very competitive and wonderful schools. So I'll share a little map, but this is the kind of the data of who gets accepted. So this is one of our applicants, Allison from last year, who was accepted to Case Western at the Cleveland Clinic. And so it's fun to see these white coat pictures because this is you after you've been through the stressful process of applying to medical school, then you're there and you're feeling good, right? So I think the pictures are really nice. And then you can see this map here. So this is actually folks from 2021 to 2024. And how many kind of landed in each state. So you can see the coasts are very popular places for people to go. We also have a good number of students that come from Texas, so they go back to Texas to medical school. But really people are all over. And when you apply to medical school, you'll come up with a list and it's going to be a pretty long list of schools. So you could really end up anywhere. It's likely you'll apply to your state schools because they tend to admit higher numbers of folks that are from that state, giving back to that community. But also, like I said, you could really land anywhere in the country. Some more pictures just because they're so nice. After you get into medical school. And also part of the process we have once you start the application cycle is to connect you with alums. So we connect you with an alum mentor for the process. And then once you get an interview at a school, so you'll email Cindy and I and say, yeah, I got an interview at Tufts or wherever. then we send you a current medical student or a recently graduated medical student from our alum list, and you reach out to them and say, tell me about the school. Tell me how your interview went. So we really try to connect you to alums as much as possible without stressing the alums out too much, giving them too many people to talk to. Okay, so that's where I end. I know I talked a long time, but I really want to open it up for any additional questions you all have for me today. And this is just contact information. I will